Hello my friends, my name is Dr. Saeed Kazmi. You're watching my YouTube channel. In today's lecture, I'll be talking about pulmonary valve stenosis. Now, pulmonary valve, which is one of the four valves of the heart, this consists of three leaflets that open and close repeatedly to let blood out and then prevent blood from returning to the right side of the heart. Now, these leaflets can sometimes develop abnormally, either becoming thickened or they can get fused to one another. So what this happens is then this results in a narrow opening between the right ventricle and the pulmonary artery, and we call it as congenital pulmonary valve stenosis. Now, congenital pulmonary valve stenosis can occur as a solitary condition, cardiac condition in some kids, but in many cases we have seen that it has got associations with other problems. It can be associated with some of the conditions like tetralogy of Fallot. Now, tetralogy of Fallot is a congenital cyanotic heart disease, and it has got four things in it. That's why it's known as tetralogy. And one of those four criteria is pulmonary valve stenosis as well. The other condition in which it can be associated is Williams syndrome. Now, Williams syndrome is mostly associated with supravalvular aortic stenosis, but sometimes it can also be associated with a right-sided heart problem, especially pulmonary valve stenosis. The third association is with Noonan syndrome. Now, Noonan syndrome, which looks very much like Turner syndrome, has got right-sided heart problems, and one of the commonest cardiac problems found in Noonan syndrome is pulmonary valve stenosis. And last but not the least, it can be associated with congenital rubella syndrome. Now, in congenital rubella syndrome, what happens is that the fetus get in utero rubella infection, and then it leads to problems with the development of the organs. Especially, it can lead to problem with the development of the right side of the heart, leading to congenital pulmonary valve stenosis. Now, question is how it presents. Now, isolated pulmonary valve stenosis can be completely asymptomatic. So if it's a mild stenosis, the affected children may not have any problems, and it might be discovered as an incidental finding. We know, especially when you are examining child for anything and you find an incidental murmur, a systolic murmur during routine baby checks. But if the stenosis is more significant, then it can present with certain symptomatology, and that symptomatology could be fatigue on exertion, especially when the child plays or tries to do something, some activity. He feels weakness, and he gets tired very easily. The child can have shortness of breath, so when he tries to play or when he tries to go upstairs and do some activities, he easily gets out of breath. It can also be associated with dizziness, and sometimes the children can faint as well. Coming down to the signs, so when you are examining these kids, so the signs usually the most common sign is an ejection systolic murmur, and this ejection systolic murmur is heard loudest at the pulmonary area. So the pulmonary area, which is the second intercostal space on the left side of the sternum, usually there you would find that the murmur is the loudest. Sometimes if the murmur is of high intensity, you might also be able to palpate a thrill in the same area. If it is associated with right ventricular hypertrophy, or in other words, it's been going on for a prolonged period of time, then the right ventricle would get enlarged, and that would lead to right ventricular heave. So if you put your palm of the hand during examination, you might feel that there is like a sustained heave, which is caused by right ventricular hypertrophy. And if it is leading to increased backward pressure, then you might also see increased JVP, especially in older children. As far as the diagnosis is concerned, I mean, the diagnostic gold standard is an echocardiogram. So an echocardiogram would actually give you a complete picture of the stenosis, and you can not only measure the valve parameters, but you could also see the flow gradient across the stenotic valve. Nevertheless, initial tests are usually an ECG and chest X-ray. So ECG might show you signs of right ventricular hypertrophy, or in severe cases right axis deviation as well. As far as the chest X-ray is concerned, because there is pulmonary stenosis, less blood would go towards the lungs, and you would be probably seeing oligemic lungs. So you might see increased cardiac shadow because of the right ventricular hypertrophy, and you might see oligemic lung fields that are actually dark lung fields with less blood markings. Coming down to the management or treatment, Well, if it is a mild pulmonary stenosis without any symptoms, now patients generally do not require any intervention. I mean, they are followed up by the cardiologist, and the usual strategy is just wait and watch. But yes, if the patient is symptomatic or the valve is significantly stenosed, then we can have certain options like balloon valvuloplasty. So in balloon valvuloplasty, a venous catheter is inserted under X-ray guidance into the femoral vein, then it goes into the inferior vena cava, then into the right side of the heart, immediately, then ultimately into the pulmonary valve, and then we dilate the valve by inflating a balloon. So if the valvuloplasty can be done, well and good. If it fails, then open heart surgery is another option, in which the stenotic valve is replaced by a mechanical valve or an artificial valve. So this is the treatment that can be done in cases where there is significant pulmonary valve stenosis or the children are very much symptomatic. So this was all about congenital pulmonary valve stenosis. If you've got any questions, you can put it down in the comment section below and I will answer them as soon as possible. Have a very good day and bye-bye.